This is TTT Live. I'm DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to Candice Alcantara, Communications Officer at the Ministry of Health, who is moderating today's proceedings.
Good morning, Trinidad and Tobago. Happy New Year, and welcome to the Ministry of Health's virtual media conference on the national COVID-19 response. I am pleased to welcome back to today's panel the Honorable Terence Singh, Minister of Health, Dr. Erica Wheeler, PAHO WHO Country Representative for Trinidad and Tobago and the Dutch Kingdom Islands, and Dr. Miriam Abdul-Richards, Principal Medical Officer for Institutions. I am Candice Alcantara, Manager Corporate Communication at the Ministry. It is my pleasure to be back with you for 2021 as we continue to work together to manage this pandemic. And a special thank you to my colleague Al Alexander, who moderated over the past few weeks. We begin with opening remarks from the Honorable Minister of Health, Terence Singh.
First of all, good morning, Candice, and welcome back.
Thank you, Minister.
To the hot seat. Good morning, ladies and gentlemen of the media. My colleague, Dr. Erica Wheeler of PAHO, and Dr. Miriam Richards. Good morning to the ladies and gentlemen of the media and members of the public listening and viewing. So today we are continuing the discussion on vaccines. I think it's a very topical issue, and rightly so, because many people see the rollout of vaccines as one of the main weapons in fighting this global pandemic. So we would have started in the new year on Monday with a discussion on vaccines and where we are. And we'll be continuing and deepening that conversation this morning with Dr. Erica Wheeler from PAHO to give you the PAHO's perspective on the coronavirus vaccine and what we should be expecting by the end of the first quarter in 2021. So we have been, since July of last year, actively preparing for the rollout of COVID-19 vaccines. I would have given just before Christmas a detailed rundown on all the steps we have taken since then. No need to go into that detail again. I just want to reiterate, because coming out of the questioning on Monday's press conference, and I did make the point, and Dr. Wheeler could probably go into that, the PAHO region, the Caribbean, Central and South America, are accustomed over the decades of rolling out mass vaccination programs as opposed to so-called developed countries or first world countries. We have that institutional knowledge, we have the setup, we have the logistics, and we have been doing that successfully for decades. So this is not the first time that countries like Trinidad and Tobago in the PAHO region will be doing a mass vaccination program. However, we do have to adjust and customize the program for the COVID-19 vaccine, especially as it refers to cold chain protection. The vaccines, and it needs to be repeated, will be initially rolled out in part 1 of phase 1 to the most at-risk people, that is healthcare workers, persons in long-stay homes. And the rationale for this is simple. If you look at what is happening abroad in some countries, as much as 50% of the deaths in those countries came from these long-stay homes. So we have scientific rationale and data to support that. And of course, our healthcare workers also need to be protected first because they are on the front line. We have been working very closely with PAHO and Dr. Wheeler. I want to thank Dr. Wheeler publicly for all the support she has been giving Trinidad and Tobago in this vaccine rollout. Coming out of Monday's press conference again and previous press conferences are the myths about vaccines. Vaccines have been part of our lives, my life, and I'm 63 years old, and other people, for decades. As children, we would have had scars due to vaccines, but we don't have that again. We don't have that again because the science has improved. But vaccines are the global response to saving lives and warding off health threats. As we manage the public information about vaccines, I want to ask persons, as we start the education program, where would Trinidad and Tobago be without the measles, mumps, and rubella vaccine that all your children must have to get into school? Where would we be without the smallpox vaccine? And smallpox has been eradicated globally, Dr. Wheeler, correct? Because of vaccines. Chickenpox, hepatitis, diphtheria, yellow fever, rabies, and I want to focus on one vaccine that has not only saved lives, but has improved the quality of life for those persons who receive the vaccines. And I want to focus a little bit on polio. Everyone knows that, and I'm not a scientist here, but Dr. Wheeler could go into it, about how the polio survivor who wasn't vaccinated, how it affects their legs and the quality of life you have. The polio vaccine, and I just want to read a little report here. The incidence of polio in the United States and European countries declined rapidly after the licensure of the polio vaccine in 1955. But in some countries, there's no mass vaccination program for polio. So there have been sporadic outbreaks. But listen to this statistic. In spite of outbreaks, the Global Polio Eradication Initiative has reduced the number of reported polio cases worldwide by more than 99%. Think about that for a minute. Think about the life saves, but the quality of life for survivors of polio who don't have the lower limb paralysis and so on. Think about it. So, as we deepen the conversation on vaccines, I just want to remind the population that Trinidad and Tobago, like many countries in the Paho region, including CARICOM, has always had a robust mass vaccination program. What we'll be doing for the COVID-19 vaccine rollout is to tailor it to suit the particular type of vaccine which we get for the region, especially as cold chain integrity is concerned. So that's my very short update this morning, because I think we'll have a lot of questions this morning. I'm not going to be very long. So Candice, again, welcome back, and thank you for the opportunity.
Thank you very much, Minister. And we go to Dr. Richards, who will present the clinical update this morning.
Good morning, Honorable Minister, Dr. Wheeler from PAHO, and Candice, our Corporate Communications Manager. This morning, I'd like to wish a Happy New Year to all our media personnel and persons from the population who are viewing us via social media and television or traditional media. In starting this morning, I would like to thank all frontline workers that have been involved in the management and support of the parallel healthcare system. This list includes frontline healthcare workers, port health workers at the Airport Authority, the Civil Aviation Authority, the Ministry of National Security, which assists and supports the parallel healthcare system through the Trinidad and Tobago Defense Force, the Trinidad and Tobago Police Service, and the Immigration Department, the Customs Department of the Ministry of Finance, private service providers such as physicians that support the diplomatic community and Ministry of Health accredited laboratories, the diplomatic community and the Ministry of Foreign Affairs, persons from the energy sector such as the OSH HSE physicians and management of the energy sector, multilateral agencies and development banks. Thank you very much for all your support, and I wish all of you a happy, safe and productive New Year. This morning, I would like to present the clinical update as per the 5th of January 2020, and which was published in our media release number 595, which was presented on social media. At present, 74,359 persons have been tested for COVID-19 since March 12, 2020. Of this, we have had a total of 7,186 cases. Between January 2nd and January 4th, 2021, there were 8 positive cases tested. It is important to note that 5 of these positive cases actually came from repatriated nationals. At present, we have 63 patients in step-down facilities, and there are 3 step-down facilities. The Claxton Bay Correctional Facility, which has a total of 17 patients or persons. These are persons that are managed under the joint care and collaboration of the Ministry of Health and the prison system. There are 3 persons in the step-down facility at Tobago and 43 persons at the Debe Academy site. In the hospital system, there are 25 COVID-positive persons spread between 6 of our hospitals. At the Covet Medical and Multi-Training Facility, there are 18 patients. At the Quora Hospital, 4 patients. The St. Anne's Hospital, 1 patient. And the Scarborough Regional Hospital at the Fort, 2 patients. There are suspected cases at 6 of our 7 hospitals, and we are keeping an eye on the suspect cases given the recent Christmas and New Year holidays. It is important to note that 2 of the persons out of the 25 are hospitalized at the ICU at the Covet Medical and Multi-Training Facility. At present, we have 324 total positive cases, of which it is being managed, that we are managing under the system, with 228 persons in home isolation. The parallel healthcare system currently covers 25 facilities, of which 7 are hospital facilities for the management of ill patients who may be acutely ill in terms of ambulatory or ward level care, high dependency unit care, and intensive care. There are 3 step-down facilities for persons with mild symptoms who are recovering or persons who have several comorbidities. Additionally, there are 15 quarantine sites, of which 5 sites can be converted into step-down facilities as required. In closing, I would like to remind members of the population to adhere to all COVID-19 prevention measures, such as the appropriate and proper wearing of face masks, the absence of congregation and social distancing where possible, hand washing and sanitization as required, and lastly, if you feel unwell, please stay at home and contact the Ministry of Health's hotline. Further information on COVID-19 and the management of this virus can be found on the Ministry of Health's website and also via the 877 well of the Ministry of Health. Thank you very much for your attention, and I now hand over to Candice.
Thank you, Dr. Richards, for that important reminder. Next, I invite Dr. Erica Wheeler to enlighten us about the Kovacs facility and some information on vaccine safety.
Good morning, Ms. Alcantara. Good morning, Honorable Minister, Dr. Richards, again, Ms. Alcantara, members of the media, members of the listening and viewing public. A Happy New Year to all. So I would just like to take you through some information about the vaccines via the Kovacs facility, and also to speak a little about regulation for approval of vaccines. Can I have the first slide, please? The second slide. The second slide, please. Thank you. So I want to begin by saying a little bit more about the objectives of the Kovacs facility. This facility, as you know, is a unprecedented facility that was set up between WHO, Gavi, the Alliance for Vaccines, and CEPI. The vaccine manufacturers were given a big head start with billions of dollars in order to help them to develop a vaccine for COVID-19 ahead of schedule. So if you look at this slide, you would see the objective of the Kovacs facility is to end the acute phase of the pandemic by the end of this year. It is also to guarantee fair and equitable access to COVID-19 vaccines for all participants of this facility. And right now, of all the 192 member states of WHO, 190 member states are members of this facility, which is a tremendous situation to be in, where so many countries have signed up to be part of COVAX. It is also to offer a compelling return on investment by countries by delivering COVID-19 vaccines as quickly as possible. In addition, to support the largest actively managed portfolio of vaccine candidates globally. And there are many vaccine candidates, and it's changing week by week. And finally, to deliver at least 2 billion doses by the end of this year. So having said that about the COVAX facility, what I want to talk a little bit about now is the allocation of the vaccines to ensure that they are fair and equitable, and all of the priority persons who need them have access in this first phase. So, of course, the goal of giving out the vaccines is to reduce mortality and to protect health systems. And this, of course, will significantly improve the well-being of populations around the world and reduce the impact on societies and economies. We all know that there is a balance to be had between life and livelihoods. So these goals are in the context of scarce supply of vaccines, and this means that there is a need to prioritize specific population groups for vaccination in the first round. These include healthcare workers, older adults, and others with high-risk conditions. And here we are talking about persons, for example, with non-communicable diseases. So we're talking about diabetes and hypertension, for example, among others. These high-risk people are a special group, and therefore there is a global group, a scientific group called SAGE, who have been putting together these priority groups and a roadmap globally for countries to follow. And Trinidad and Tobago is following this roadmap. It's based on the performance and safety evidence of the vaccines. This is how the priority groups are chosen, and evolving data on the transmission of the disease. And we know so much more now than we knew back in January or February of 2020. So given the widespread nature of COVID-19, we know it is a pandemic, an initial allocation should be received by all as products become available. And again, this goes back to the whole purpose of the COVAX facility. So having said that, we know that at least 3% of the population comprising healthcare workers would be covered. The high-risk adults, all of them together would add up eventually to 20% of the population when we look at the priority groups, the healthcare workers and the elderly, and beyond that, those with underlying health conditions, as I just mentioned. It's called comorbidities when we look at people who have other health issues. And after the 20% level is reached, then participants from other sections of the society will be eligible. At this point in time, it is the first 20% of the population that the COVAX facility is concentrating on to get those 2 billion doses out globally by the end of this year. There will also be provision for a buffer, an extra number of vaccines that will be set aside for emergency deployment based on immediate needs. So if we look now, could I see the next slide, please? The following slide, I believe it's slide 5 that shows the Kovacs facility. Could you roll it to that slide? No, the slide 5, I believe. Could you keep going forward, please? Okay, so what I want to point out is that at this point in time, the Kovacs facility has actually, we know that they have approved the Pfizer Biontech vaccine to be one of the vaccines that WHO, the European Regulatory Agency, we know that UK and Canada have also approved. So this vaccine will be available for what is called emergency use listing. So just let me give you a little bit of information about this emergency use listing, which varies from the traditional process of approving vaccines. So when WHO speaks about an emergency use listing, it means that a risk-benefit assessment has been made of things like the quality, the safety, and the efficacy data for the use of these vaccines, and something called a rolling review of the data provided by the manufacturers is used. And why we call it a rolling review? Because traditionally we would wait until all of the possible information is available and gather it at one time and review it. But in the case of a pandemic, such as where we're at, for emergency use listing, it means as manufacturers provide the information, it is reviewed and assessed by a scientific group. And this assessment is by independent experts coordinated by WHO in collaboration with the national regulatory authorities, the WHO listed regulatory authorities in countries. So these regulatory authorities, they have oversight of all of the data that leads to what is called emergency use listing. So there's a pre-submission of data where there are meetings, and then following this, this committee also looks at follow-up to the vaccine, because it's not just about vaccine distribution that we do in WHO and in PAHO, but it's looking at what happens following the deployment of the vaccines in terms of any reactions. And emergency use listing is usually for a year because the vaccines are new and they're being studied during that period. So it is a time, the emergency use listing is time limited. And for the vaccine supply chain, then, as the Honorable Minister said, countries are used to carrying out immunization campaigns. But for the COVID-19 vaccine, we know that there are many more people who will need to be vaccinated. So this process involves getting the vaccines from where they're made to the people who will receive the vaccine. So this is a great logistical difference from maybe what we've seen before. Also, it is a very complex system in terms of the negotiation with the manufacturers of the vaccine, and nothing can be approved until the manufacturers actually send all the data on quality, safety, and efficacy, or the effectiveness of preventing the disease in an individual once vaccinated. So therefore, we have to get information from the manufacturers. There needs to be special equipment. Again, as the minister mentioned, for example, the Pfizer vaccine needs to be stored in -80 temperatures. So the supply chain needs to be carefully attended to. So you have to have the right equipment. You have to have the right syringes. Each vaccine may have a different type of syringe. So depending on which vaccines a country uses, you will need different syringes, and these need to be imported. the transportation of the vaccine as well, especially in minus 80 degrees if you have such a vaccine. That is important. You have to make sure that the carrier has the facility to do so. And then once it arrives in the country, where is it going to be stored? And how long can it be kept outside of minus 80 degrees, which is 5 days? And the personnel who will be actually immunizing the population. So building on the current immunization plan that Trinidad and Tobago has, these things will be expanded, and the ministry is very much working on these issues as we speak. So in terms of the technical support then, PAHO has been working with the ministry, as the minister has said, to provide that technical cooperation and preparation for the receipt of the vaccine. And we have been looking at the existing immunization strategies. We know it's not the first time, as we keep saying. Look at the H1N1. This is an annual vaccine program that is given not just to health workers, but also to a similar category of persons, those over 65 years in the population. So in keeping then with the Scientific Advisory Group for Emergency SAGE, the Ministry of Health has been following the recommendations for the use of the vaccine for the priority groups who will receive the vaccines, which are those persons who are more at risk, those health workers who are more at risk, the elderly, and those with underlying health conditions. So we know, of course, that there are many concerns about the safety of the vaccines, and this may very well be a question that will come up, and I am happy to address this in terms of people speaking about there being a microchip in the vaccine. So thank you very much, ladies and gentlemen, for your time and your patience. Back over to you, Ms. Alcantara.
Thank you very much, Dr. Wheeler, for shining some light on accurate information as it relates to the COVID-19 vaccine. We move into the question and answer segment of the conference. Media representatives, please indicate your name and the media house you represent before posing 2 brief questions, please. And please ask both questions at the same time. Of course, if we have extra time, we will allow additional questions. We begin this morning with CNC3, please.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Okay, so my 2 questions this morning are for the Minister of Health. So the first question, and I don't know if Dr. Wheeler would want to weigh in on this. I believe yesterday the Chief Medical Officer would have been a part of a meeting with all the other Chief Medical Officers within the region with PAHO and WHO about vaccines, where some more technical details were discussed. Coming out of that, can we have any updates on what came out of that, and maybe even if we've honed in a bit more on which vaccine we want, and if that emergency use approval by WHO is or has us leaning towards the Pfizer vaccine? And the second question, I know, Minister, that you say that you all will monitor the situation globally with the pandemic and then advise the Prime Minister on reopening of the borders. And I know you may not want to go into great detail about it right now, but does the emergence of this new strain of the COVID-19 virus within the UK and even the South African strain probably have you all as policymakers saying, okay, maybe we need to keep these borders closed for longer than we would have wanted, or does that change the way in which you all are going to look at the reopening of it?
Okay. Thank you, Richard. So you got in 3 questions there. So we'll you broke the rules, but that's all right for the new year. Okay. So yes, there was a meeting yesterday with the Chief Medical Officer and a representative from the Kovacs facility. I actually sat in on it. What we did eventually was requested some packages of information that they have promised to send about the candidate vaccines that they are looking at for this region, which are, to date, the Pfizer vaccine, the AstraZeneca vaccine, and there's one more which has not yet finished clinical trials, in addition to the Moderna, that has finished, the Sanofi vaccine. So we have asked for some extra details on those 4 vaccines, so that is what took place in the meeting yesterday. So Dr. Wheeler might want to weigh in on this one. No vaccine had, as yet, if I'm to be corrected, has been approved by WHO for this region. Pfizer. So Pfizer has been approved.
Dr. Wheeler, sorry, just put on your
Yeah.
right.
Sorry.
So the Pfizer vaccine is the first vaccine to be approved for the region. And that is one that we also asked for some more technical details for. So we hope to receive those. Once the Pfizer vaccine passes all the regulatory approvals via CARPHA, the technical advisory groups for the Caribbean, the local technical advisory group, the Pfizer vaccine can be possibly the first one to be used in Trinidad and Tobago. Where are we with the borders? I think, Richard, you are quite right. Since the start of this pandemic, we kept on saying there is more that we don't know than we know about the virus. And every time you think you are in a safe place or a safer place with the virus, those words always come back to my mind. The new variant, the South African variant, the UK variant, yes, will cause us to re-examine everything, every single thing that we do now. Because the evidence coming out is that this new variant is 50 to 70% more transmissible. Think about what that means for a country that has community spread. So yes, we will be considering the impact of that new variant in all decisions we make from now going forward. Thank you very much, Rashad.
Thank you very much, Minister. And we move next to AZP News, please.
Hi, good morning, Priya Bihari, azpnews.com, and Happy New Year to Candice, to Dr. Abdul Richards, and to Dr. Wheeler. My first question, well, actually, all my questions are for Minister. Minister, there are some questions raised when you had visited the Southern General Hospital on New Year's Day to welcome the newborn babies. Some people raised concern about whether you did follow the proper protocols, and because there were pictures of you without a mask, etc. Can you just clarify that? And secondly, in terms of the Kovacs facility, we have paid, I think,
if you can show me one picture with me without a mask visiting a patient, I will be shocked. So that is just mischief prior. The photographs with me in the papers with patients clearly showed me with a mask. When I spoke with a mask at the press conference. As a matter of fact, people told me, Minister, you should have taken your mask off. So I am quite disturbed to hear you repeating that type of propaganda prior. Please.
Well, I just wanted to clarify that, Minister, right? My question was to clarify it. So I'm grateful that you did. Yes, my second question is the Kovacs facility. We have paid, I think, $9.7 million. Would that cover 20% of the population and going forward?
Prior, I have consistently said we have paid $1.477 million to date, not $9 million. Okay, sorry. Prior, please get your facts right this morning.
But would that cover the 20% of the population, and then would we have to pay more? How does that work in terms of going forward when we need new vaccinations?
All right. So prior, I have consistently said we have paid a down payment of $1.477 million, not $9 million. And I have consistently said that represents a down payment. That down payment, as Dr. Wheeler could attest to, goes in mainly to research and development across the spectrum of possible vaccine candidates, which is one of the reasons that the Kovacs facility has been able to bring a vaccine to market. Because as both Dr. Wheeler has said last year and Dr. Carrington, one of the major factors why vaccines take so long to come to market is financing. Yes. Correct?
Correct.
But because countries, about 170 190 countries pooled resources for the first time in the history of mankind. You were able to have a vaccine development without financial constraints. So the 1.477 million is a down payment that went largely to R&D. It will cover the cost of some of the vaccines to purchase, but of course, as we get to know the price of the vaccine, the quantities of vaccines, there will have to be further payments. Okay, Prior? Thank you, my brother.
Thank you for the clarification, Minister. We move now to CL Communication, please. Are we ready with CL Communication? Okay, so I think as we get that sorted, we can go straight to TV6.
Hi, good morning. Alicia Boucher from TV6 News. I know that some time back we were given a list of 17 other recommendations. I believe it was by WHO or PAHO. It was one of them. Can you, Minister, tell me how far along are we in terms of fulfilling the 17 recommendations to be able to get a vaccine? And since we are looking at the Pfizer Biontech vaccine at this moment, how ready are we to receive that particular vaccine?
Thank you. Sure. So this is actually the spreadsheet. This is actually the spreadsheet of all the parameters we have to cover. Basically, of all the parameters on page 1, we are either light orange, orange or green, which is a good place to be, of all. Page 2, you will see some reds in that first column. With time, all of those reds, which were areas of concern or that we had to redo things, have turned to orange. So there's no red on this page. Page 3, we have some reds some time ago and then 2 remaining reds. So we have 3 red areas, which means they are areas of concern out of a total of over 100. The remaining reds have mainly to do with the logistics of which vaccine we are to receive. So we can't solve those reds until we know which vaccine we are to receive. So for instance, the Pfizer vaccine has to be stored at -72. The Moderna vaccine at -20, the AstraZeneca at 2 to 8 degrees. So the remaining reds have to do mainly with the particular vaccine. Once we know which vaccine we will get, then those reds turn to orange and then orange into green. So that is where we are now. We're in an excellent place. And I have the spreadsheet here to prove it. So let me just go through one more time. Page 1. Mainly green. Page 2, mainly orange and 1 green. No more reds in the second column. It means those issues have been addressed. And page 3, some of the reds have gone to orange, and we have 2 more remaining reds to see about, which have to do mainly with the logistics for the particular vaccine, which we don't know which we are going to receive as yet. Okay? So, Alicia, that's a very comprehensive answer. Thank you very much.
Thank you very much, Minister. And just for clarification, you were focusing on the second column.
Yes, the second column.
Okay. All right. And as you know, from time to time, we respond to questions received from the public to ensure that you have accurate information directly from our subject matter experts. And so we go to that now. Our first public question. Does the COVID-19 vaccine alter your DNA? And I believe that Dr. Richards is going to respond to this question.
Thank you, Candice. That's actually a very interesting question and one that's very topical. So the summary answer to that question would be that the vaccine does not alter your DNA in the long run. Now, the way that the current vaccines work is that they do initially insert a DNA strand into the nucleus of the cells. However, once the immune response is mounted towards a vaccine, that DNA is destroyed. So in summary, the COVID vaccine does not alter your DNA. Thank you.
Thank you, Dr. Richards. Another question, and I think Dr. Wheeler already started to allude to it, so I think she'll respond. Is there a microchip in the COVID-19 vaccine?
Thank you for the question, Candice. Of course, the short answer is no. The longer answer is that we do in fact know what are all of the ingredients, say, for example, of the Pfizer Biontech vaccine, because this information has to be given to WHO and PAHO as part of the review and the assessment of the quality, safety, and efficacy of the vaccine. So there are actually 10 ingredients in the Pfizer-BioNTech vaccine, apart from the RNA, which is called the messenger RNA, which takes the material into the body, and the body reacts on the basis of receiving this material. So this active ingredient called the messenger RNA, it contains genetic instructions for the coronus protein, which is the spikes on the vaccine. And once this is injected into the human body, it instructs the cells to manufacture the spike and expose the immune system to something it recognizes as an enemy. And the idea is to help the body learn to distinguish the features of the virus and so react to it by attacking it and squashing any negative effects of it. This messenger RNA rapidly degrades and it leaves no trace in the body. So that's the active ingredient. The other ingredients are chemical ingredients called lipids, even cholesterol is part of that, and salts, potassium chloride, monobasic potassium phosphate, sodium chloride, which is salt, and basic sodium phosphate dihydride. And then the only other ingredient is sucrose, and that keeps the nanoparticles from clumping up together when they are frozen in storage. So you can see from this list of 10 ingredients, there's absolutely no microchip. And this is something, as I say again, that has been reviewed. All the data has to be submitted to WHO, to the scientists for review and for assessment. And there's no way in the world that WHO and PAHO will allow any vaccine that has any damaging material in it to be approved for global use. So that's the short answer, no, and the long answer, I give you the list of ingredients. Thank you.
Thank you very much, Dr. Wheeler. Took me back to my chemistry, CSE chemistry days. Sodium chloride is salt. I have forgotten that one. And Minister, you started to address this one.
Which one is that?
Who is eligible for the COVID-19 vaccine?
All right. So who is eligible? Before I answer that specific question, I just want to go back to the question about the microchip, if you don't mind, to tell the country how that conversation started. So we have to be so careful. It was Bill Gates, who is part of the CEPI arrangement through the Bill and Melinda Gates Foundation, who are helping to provide financing for the development of vaccines. Bill Gates made a statement about a digital certificate of vaccine records. That is what he said. But the conspiracy theorists took that statement about a digital record, similar to the little card we have, that all of us have, where you go to a health center to get your vaccines, and you record it in that physical card. He was talking about a digital record, but because of his association with Microsoft and technology, the conspiracy theorists took that statement and converted that into the vaccines having a microchip. So I just want to bring some further clarification as to how conspiracy theorists work. So the specific question about who is eligible. Okay. So in part 1 of phase 1, we'll be targeting those people who we consider to be high risk with high exposure. So high exposure will be, of course, frontline healthcare workers. doctors, nurses, wardsmates, security guards working in a health facility. High risk will be those elderly in long-stay facilities. You know, our grandparents who are in a long-stay home. We are also targeting in part 1, phase 1, those persons over 60, especially those who have diabetes and hypertension, right? And we'll be doing that in both the private sector and the public sector. So those are the categories of persons stratified to receive the vaccines in part 1 of phase 1. So let me just repeat it. High-risk people, healthcare workers. Healthcare workers does not only mean doctors and nurses. It could mean the security guard because he is exposed to the public. It could mean the person pushing you in a wheelchair. All of that. Other persons, the persons in long stay homes, our grandparents, the elderly, we want to target them. And those persons over 60, especially with those comorbidities, diabetes and hypertension, who make up over 90% of the 127 people, unfortunately, who have succumbed to this disease. So you want to get the biggest result in that initial investment. You want to get bang for your buck in that initial phase. So I hope that answers the question, Candice. Thank you very much.
Thank you very much, Minister. Just a reminder that these are questions that we receive from the public via social media, via calls, via emails, and so you can continue to send your questions and we will respond.
Candice, if I may, these are not only questions that we get from the public, these are also the questions we are going out to with the public when we do our focus groups. So we ask our focus groups this, and the persons in our focus groups also ask us similar questions. So that's why we are bringing these questions to the fore. So it is a reflection of what people are asking and what people are concerned about.
Yes, thank you very much, Minister. And we continue now to field questions from the media. I think CL Communications is ready at this time.
Are you hearing me?
Yes, we can.
Okay. Basically, countries regionally have been experiencing a spike in COVID-19 cases. Have any of those countries reached out to Trinidad for assistance in any form, either through the CMO regional meeting yesterday or through the CARICOM? And then my second question is, nurses at the Port of Spain General Hospital have expressed concern that there is looking like a possible spread of the virus within that hospital. I was just wondering if you can touch on that for a bit. Thank you.
Sure, thank you. So the CMOs of the region talk to each other. So if any CMO wants to reach out to any other CMO for technical advice, support, advice, that is freely shared amongst the CMOs. At the ministerial level, we are in communication as ministers of health. Recently, I was in communication with my counterpart in Jamaica, the Honorable Chris Tufton. I was also in touch with my colleague in Grenada, Honorable Nicholas Steele. We had a virtual meeting of all ministers of health under COSOD some time ago. And that's a forum where we share ideas and share best practices. So the answer is yes. On the issue of Port of Spain General Hospital, I personally, as Minister of Health, and at the Ministry of Health, we view that very, very seriously. The safety and well-being of our staff across all levels of staff is our primary concern. We viewed it so seriously that yesterday morning at 8:30, myself, the CMO, and the PS met with all CEOs across the board yesterday morning to discuss the issue and to come up with solutions to make sure what happens in Port of Spain isn't replicated across the healthcare system. The CMO advised on how to address it from an infection prevention control measure and to alert the doctor in charge of infection prevention control at Port of Spain as to possible steps. Following that, the CEO had a meeting on our suggestion with the President Edie Stewart of the TTRNA to discuss in a very solution-oriented fashion, how they could work together to find solutions and to implement solutions as soon as possible. And the CEO and the Chief Operating Officer, Infection Prevention Control Doctor, they are all aware of the situation and will do the best for our healthcare workers. Thank you very much.
Thank you very much, Minister. And we go now to Express newspaper, please.
Hi, good morning. Camille Hunt, Express. I wanted to get an update on the tracking bracelets to monitor people in home quarantine, because I've seen some Caribbean countries have recently begun using them. And we've talked about using them here, but because we have had a few incidents of people breaching quarantine. So are we still looking at introducing those bracelets?
Yeah, so thank you. So that is exactly why I had spoken to my colleague in Jamaica, as I said earlier, and in Grenada. They have recently started it in a limited way. We are monitoring how it is going there, and the final decision to do that is a decision we'll have to make between the Ministry of Health, the Attorney General, and the Minister of National Security. But just to say, as I stated before, that will have to be at the discretion of the person. It is not mandatory because of our constitution and right to privacy. So we have a slightly different arrangement where it will be offered. In the case of Jamaica, they are using it primarily at this time for their returning persons from the United States. What you call them? The persons who have been released from jail across there, who are sent back. Deportees. Yes, in Jamaica, they are using it mainly for deportees at this point in time. It is not being used across the board. So we are looking on at Jamaica, Grenada. I also asked for a report of how it is being used in the Cayman Islands. Yeah, yes. And Dr. Wheeler alerted us to the fact that Cayman Islands is also using it, and we will see what the results are and to see how applicable it is in Trinidad and Tobago on a voluntary basis, not a mandatory basis. Okay? Thank you.
Okay. Thank you, Minister. Let's see how many follow-up questions we can squeeze in. We go to CNC3, please. One brief follow-up question.
Okay, great. My question is to Dr. Richards. What protocols do we have in place to really prevent this new strain of the virus from coming into the country? I know we have the quarantine and all those things, but is this going to be enough to protect us from getting that strain into the country, especially with repatriations?
Thanks, Rashad, for that question. The management of the new strain would really be divided from a policy and an operations perspective. For the policy perspective, i.e. controlling the repatriation levels, changes to the current Ministry of Health quarantine terms and conditions, I would refer that to the Honourable Minister and to the Chief Medical Officer, pending decisions and meetings with the Honourable Prime Minister and Minister of National Security. I can talk a bit about the operations segment and the response through the parallel healthcare system. Currently in the parallel healthcare system, there are 1,741 beds. The limiting factor, or what we are concerned about with the new strain, would be the availability and occupancy levels of hospital beds for persons, for that 5 plus 15, 20% of persons who require a high dependency unit and ICU care. What I can tell you, Richard, is over the last 6 weeks, the parallel healthcare system occupancy in terms of ward level beds has ranged between 9 and 15%, and at the ICU level has ranged between 2% and 11%. At the HDU level, we are between 0 and 16%. We've seen these occupancy levels decrease over time, and that's been the trend over the last 6 weeks. Another factor that we are considering would be in response to the repatriation exercises. Last night, we had a very successful repatriation exercise where 126 persons returned from New York City to Trinidad and Tobago. This evening, we have another repatriation exercise in which 135 persons have been granted exemptions to enter Trinidad and Tobago from Barbados, and a similar exercise on the 9th of January for returning nationals from Miami. Again, we've been going with a number of 130 to 140 exemptions that have been approved by the Ministry of National Security. as the purview, the Ministry of National Security's purview would really be the authorization for persons to enter the country. So in response to this, the parallel healthcare system has demonstrated a level of resilience with respect to managing the COVID-19 pandemic. And in Trinidad and Tobago, we would really be depending on the responsiveness of the parallel healthcare system and the associated elements, that is testing from CARPHA and our 5 hospital laboratories. So I hope that answers your question. Thanks.
So let me just flesh out the response that Dr. Richards has given you, because Richard, you raise a very important topic. So from a policy perspective, to, as far as humanly possible, prevent the new variant, whether it's the South African variant or the UK variant, from coming into Trinidad and Tobago. One, the government of Trinidad and Tobago has maintained a closed border policy. And I think that policy is what has saved us. Our borders are closed. You look at other countries that had uninhibited flights from the UK. They had, in the space of hours, isolate the UK because their borders were open. So that's one policy perspective. The second policy perspective is that the Ministry of Health, CARPHA, and the University of the West Indies have joined forces to do genomic sequencing of selected samples from Trinidad and Tobago to see if that variant is here. Professor Christine Carrington was here on Monday, and she indicated as of Monday, and everything is so far, they have not picked up the UK variant. Let me explain to the population, because this is an excellent issue that you have raised, Richard. Let me explain the policy position, how we determine what samples to test. The Ministry of Health turns over samples to CARPHA. We just don't turn over samples at random. Because we are trying to track a new variant being brought into the country via repatriation flights or via migrants, we are taking particular samples according to CARPHA's case definition of a particular viral load. We are taking those samples from people who have been recently repatriated and from our migrant population who meet the clinical criteria. The same is being done for all the CARICOM countries. These samples are sent to CARPHA, and then those samples are in turn sent to UE St. Augustine for sequencing. It is that process that alerted Jamaica a few days ago that they did have the variant. So we are in the same position as Jamaica, working with CARPHA and working with the university to do this genomic sequencing. And we are taking samples, as I said, from returning nationals and migrants, not just from the community in Trinidad and Tobago, because you are trying to find out if this variant has come into the country. Okay, Richard, and I want to thank you for raising that issue.
Thank you very much, everyone, our panelists, members of the media, and the viewing audience. We have come to the end of today's virtual media conference. It's one thing that COVID-19 has taught us is that health is everyone's business. So please make an investment into your own health. If you don't need to go out, please stay inside and share time with your family. And if you do go out, of course, wear your mask.
Where you hustling now up to? This is the beach. You're supposed to be relaxing.
Well, I'm going to get some bacon shark.
Oh, all right.
Yeah, me and my boy, yeah.
Just remember, it's still a COVID out there. Beach or no beach? Yeah. Hey, you wash your hands? Where's your mask? You know what? 10 things to remember when you're by the beach. If you're sick, stay home. Wear a mask. Oh, Social distance, remember, 6 feet. Avoid large crowds. Yes, yes. Oh, remember, don't socialize with people you don't live with. When you're going to buy your food by the food vendors, make sure that they have the badge, the mask on, and the gloves. Oh, and make sure that they have somewhere that you can wash your hands and sanitize. Do not be sharing beach toys with